Lucrezia Borgias, the illegitimate daughter of the Pope and his mistress during the Borgias era of the Italian Renaissance, grew up to become one of the most infamous members of the powerful Borgias clan. Storytellers depicted her as a femme fatale, a seductive woman who poisoned those whom she could not manipulate, though most of the characterizations have little to no basis in fact. The legend says that the poison she used was called the Cantarella poison, and she would slip it into the food or drink of her enemies from the ring she stored it in. Though there is a significant lack of evidence in regard to the poison, speculation over the years has led to the presumption that Cantarella was a variation of arsenic, which is what we will be delving into chemistry-wise.
Arsenic induces apoptosis, which is programmed cell death. It has adverse effects on DNA repair and methylation of DNA, and it increases free radical formation and activation of the proto-oncogene CMYC. Toxic effects result from indirect gene expression alteration. For example, arsenic advances oxidative stress and impairs DNA repair, which magnifies mutation rates and can lead to cancer. Symptoms of arsenic poisoning include nausea, vomiting, abdominal pain, diarrhea, acute psychosis, memory loss, confusion, diffuse skin rash, toxic cardiomyopathy, and seizures. Acute poisoning is 1.0 to 3.0 milligrams per kilogram, while chronic poisoning is 0.1 to 0.5 milligrams per kilogram over an extended period of time, which leads to multisystem disease and malignancy, can cause skin cancer, cardiomyopathy, cardiac arrhythmias, and myocardial injury. A fatal dose would kill the victim within a couple of days. Lower doses can still be fatal, but take around a few weeks to kill the victim and are only lethal if ingested daily. One antidote is the use of antioxidants, which scavenge the extra free radicals that arsenic can cause, but that is only curative for small doses. Dimercaprol is a medication used to treat acute poisoning by arsenic, and it is injected into a muscle and works by binding with heavy metals. The dimercaprol competes with thiol groups for binding to the metal ion, and it can then be excreted in the urine. However, it's actually toxic itself with a narrow therapeutic range, so researchers are still pursuing less toxic antidotes.
In animal studies of arsenic poisoning, LD50s reported for rats, mice, and rabbits were 2,449 milligrams per kilogram, 1,800 milligrams per kilogram, and 100 milligrams per kilogram, respectively. Obviously, because of its toxicity, experiments cannot be done in humans, though there aren't specific values for LD50s in humans.